Good evening, doctor.
Good evening, sir.
How are you?
I'm fine, sir.
I need your kind name.
I'm Dr. Gayathri.
Hello, Dr.
Hi,
Gayathri. Where are you from?
I'm from Salem, Mettudan.
Okay. When did you pass out?
2016.
Great. So tell me your journey from 2016 to 2022. Tell me your journey. Your story.
Yes, sir. I was actually working for a clinic, local clinic there in Salem for 1 year, and then I went to the Angri for entrance preparation for NEET. And then after I worked uncontinuous work, like preparation work I was doing. And then finally I thought clinic is the only thing that we can do and make earn and make money out of us. So I searched for implant programs for training. So then I got much reviews from YouTube, and then I joined Malligai. Now I have finished my implant competence program. Now
Okay.
I'm little confident about implant.
Good, good. And glad to tell that she got selected even in the army, and due to some reason she couldn't join. And glad to know that she also got oral surgery. Due to some other reason she couldn't join, but she's going to make big in her own clinic. I believe in that.
I also believe.
One thing I want to tell about her was I observed her. She was very confident, very positive, very open for learning, and she was also very interested to easily capture new things like in dentistry. So let's ask about her implant experience in Malligai Dental. Okay, right from the theory, let's talk about the theory part. We have given access online. So a lot of people said, sir, online, how to study and all that. I said, it's a very simple class. I want to know, did you study fully, sincerely?
No, I didn't study sincerely, but half of the things I learned, it was useful for me. From interpretation, CBCT and X-ray interpretation till prosthetic rehabilitation, everything is there in online, and also practically we do on patients. It is very useful for me.
Okay,
it was
so
useful.
How was your case experience?
Case experience was also so good. Sir was supervising and helping us throughout all our procedures in every case. So it was very helpful for me. We utilized the maximum of our time and we learned much. Many of variety of cases we have seen, like full mouth rehabilitation and healing abutment placement, cover screw placement, and sinus lift procedures, indirect sinus lift procedures, and like how to manage in difficult situation, critical situation. Also, sir has taught us. Sorry.
Okay, so in such a short time, everything you learnt. So, is it difficult to understand or is it easy for you?
I think with proper guidance, everything will come in place. So, with proper guidance like sir and everything we can learn, I think so. Hope so.
We are going to give you WhatsApp support also for your case planning. You can send us CBCT. We can do some planning for you guys and support you.
And updation is very important in dentistry. So, we can... like in future also, we will trouble you for updation and we will learn much of the things from you.
Sure. And what about the facilities at Malligai Dental Academy?
Facilities
you like the place, the people?
Yeah. Actually, good. First thing is good ambience in the clinic and very advanced approaches and instruments are there in clinic. Very good, sufficient space for patients and for staffs and doctors to work. Many advanced treatments we are doing here, and everything is good, sir. Actually, accessible. It is the Malligai Dental Academy is very accessible for everyone and also for every case.
Thank you so much. And your learning in this learning, can you tell a memorable thing like, sir, this was very touching or this was very curious? What you can say in that learning?
In learning or in practical?
In practical.
Practicality, patients were so calm and they are so comfortable. They were so comfortable to doctors, and they know the procedure and they had much knowledge and awareness about dental procedures, and they were so cooperative to us. That is the main thing. Next. So
you were very impressed with the cooperation of the patients,
and also. Yeah, that is the only thing. Patients are so aware of the dental treatment, and the thing is we can try every procedure on patients. That is the main advantage. So Malika Dental Academy is offering us many patients to work on. Practical knowledge is much important.
Yes. See, we believe in working on patients. We don't believe in just teaching, showing a number of slides that you would have gone through already. But all I want you guys to understand is to get into the mouth and learn from the real patient with real bone experience. Touch the patient. Every patient is different. Not all are same. Like some patients are extremely cooperative. Some patients are very fearful. This is what I want the youngsters to learn. Some patients, like we operated on so many cases, so many jaw, upper jaw, lower jaw, right, left, front, back, everywhere we operated. But you can see certain people are with their mind are very positive. If they are positive, we are positive. If they are frightened, we also get upset, our emotions. So you should know to control your emotion. In spite of patients are not being very cooperative, we should learn to take control of their behavior also, their emotion also, so that you be confident and you do.
And people and staff, mainly doctors and staff are treating patients like their family and friends. So the patients are also comfortable to doctors. That is the main thing. Yeah, sir.
One thing I also want to tell is my staff have helped me a lot to organize this. I thank them also. And because
right
of
from everything,
yes,
allotting cases to doctors.
Yeah. You know, there is a big process happens every course, like before course, during course, after course. Getting the person, arranging the, talking to the participant and collecting the fees and booking the patient,
allotting patients,
and educating the patient, taking a CBCT of the patient, model of the patient, photography of the patient, documenting everything before in advance, then plan for the sizes of implants and arrange them, exchange them, then think any contingencies happen, what if this goes wrong, what if that goes wrong, whether we need bone graft, whether we need a wider implant, what will happen if we drop this implant, what will happen if this machine goes wrong, this x-ray goes wrong, what will happen if we don't have a sensor again, whether to do serially or parallelly, which is like two doctors operating on two chairs simultaneously, or one doctor do and one doctor do like this. So I also want to tell, so difficult to understand the mind. Before I see all of you, I used to think how much skill she is having, how much skill he is having. And I also have to think like this, okay, first give them a plain implant case, like give them a straightforward case, the day one, to give them a confidence, to give them a boost. Then I think like this, okay, let them go for the second stage, okay, which is extraction and implant placement. Slowly sweat drops start coming, the day two. Third day, you know, difficult cases, sinus lift cases, this case, that case. So we will push you into this kind of scenario in such a short time, so that when you go to your clinic, there is no other scenario you will face other than what you're seeing here. It could be either a deficient bone, or it could be a sinus, or it could be a nerve. What will happen if you go close to the nerve? How to manage it, and how to plan with the CBCT, how to plan your sizes, and I just want to ask you one more thing. Like we discussed few full mouth cases which I planned through the phone and executed.
Yeah.
So how was those experience when I showed you? What did you thought? What came into your mind?
That was actually life-changing for patient, because patient was not conscious about her smile before the procedure, and she was so happy after the procedure. The difference we make in patients is so important for us actually. And nice planning of case and nice execution of case is also important.
And right choice of implants, right choice of the processes.
Within particular time, like within, yes. And the patient is also abroad patient, so
yes, traveling patient and less time, and
nice
no chance for any errors in the planning. You know, I want all of my participants to learn this from me.
And every step
I am available till I am available in this earth to all of you to ask any doubts. Anything, it's just a matter of time. You will be learning even more better things will come to you, because the world is now open. So many universities, so many colleges, conferences are keep happening. Keep learning, have a passion, be a fire in implantology, because implantology is such a lovable subject for a general practitioner like me, because I cannot feel good with anything in dentistry Second thing is I love smile designing. I love veneers. I love all the photography stuff, documentation. What do you say about it?
Yeah, sir is also getting well versed in photography now. Actually, sir is multi-talented, I will say, because he is well versed in photography, aesthetic part, implant, prosthetic rehabilitation part, and he is also conducting courses for patients, nurses, and also for doctors.
Yes.
I think a peaceful.
So I am like a Rasagulla, okay. I am a dental Rasagulla. I am in the jira of dentistry, sucking all the sweetness of dentistry in various parts. Dentistry is such a sweet subject because I love this subject from day one. I joined dentistry. Though I couldn't complete many things in dentistry, I am doing my full attention to full energy with whatever I am having. And God has rewarded me for my hard work. God has rewarded me for the efforts I am taking. And I wish the same for all of you. You should become 1,000 times more than the teacher. Okay, when you go to a teacher and say, I become a doctor, they'll be happy. I become an army officer, they'll be happy. Likewise, when you say, sir, I have 10 clinics, I have got my own franchises, I have got my own businesses now. I want you all to be successful, not only in dentistry, first in family life and in relationship, in health. Then comes the profession, then comes other things, okay? So thank you, Dr. Gayathri, for your lovely feedback. And I would strongly recommend you to share this to many people as possible, so that they will come and they will come and learn from us. And we are very welcome to have anyone who is being referred to go through these trainings.
Okay, sir.
Thank you. And I convey my wishes to your husband, your young small baby. And your son is getting his first birthday tomorrow, day after tomorrow.
Day after tomorrow, yes.
So my prayers are there.
Thank you,
and
sir.
all of our well wishes.
Thank you.
And this is one of the happiest moments of your life.
Yeah.
I think after all your struggles and hard work, this first birthday of your son, life-changing things will happen.
Yeah,
we wish everything will come to your place.
Thank you, sir.
Life may seem little setbacking sometimes, but the more you set back, the more you are going to go up. It's like a rubber band. When you push the rubber band back, whatever you keep, whether it is a small pin or a paper, it will go far away.
Okay.
So when life sets you back, you are going to move forward.
Okay, sir.
All the best.
All the very best for your career, sir.
Thank you, dear. Thank you. So, dear friends, thank you for hearing such a lovely story of Dr. Gayathri. If your life has to change, please come to us for RCT, ortho courses, cosmetic courses, implantology, and practice management. I want all of you to subscribe to this channel so that you get regular updates and testimonies. Thank you, Dr. Gayathri, once again. Thank you and God bless you.
Thank you.